optimizing gut health is a big one that a lot of people can overlook. But if you have inflammation in the gut, there's a lot of mitochondrial microbiome crosstalk. So if you have mass amounts of inflammation in the gut, that's going to cause leaky gut and lead to endotoxin in the bloodstream, which is going to contribute to systemic inflammation. And that's not optimal either. So that'll affect your lipids and whatnot.
Well, let's stick on the gut piece here for a while. You dedicate a whole chapter in your book to this. For somebody who wants to get in and see where they're at when it comes to gut health and get a picture, is there a certain test you recommend to start off? And then I want to get into some of the nuances of taking care of the gut, maybe some specific supplements or protocols we can do to enhance the gut health. Let's really unpack this.
Yeah. So I would say gut testing is still fairly controversial in the medical communities, but I personally find them to be highly beneficial for optimal health. So I use a GIFX test on all my clients, and it's particularly helpful if somebody's like just taking antibiotics, because you can really see dysbiosis when someone's taking antibiotics, and you can be like, hey, you clearly wiped out your good bacteria. Let's replace those with some probiotics. I've also picked up things like inflammatory bowel disorders, elevated eosinophils. Clearly someone's reacting to something in their diet. And like blood and stool. I found a client that had blood in his stool, and he ended up having a polyp that he needed removed, that if he had not removed, he would have ended up with colon cancer. So that's kind of interesting if you think about it that way. Aside from that, a lot of people have sort of like poor digestion in general, and they may need digestive enzymes. And you can see that on these tests if someone needs to add enzymes to their day. So I like to use these tests because it can tell me like, do they have good bacteria growing? Do they not? Do they need more Akkermansia? Do they have too much Methanobacter smithii, creating too much methane? Do they have signs of too much bacteria? Maybe they have overgrowth. Things like that can be problematic for optimal health. So, seeing if somebody has small intestinal bacterial overgrowth is also helpful.
All right. So we know there's a testing for people that want to get into the details, get into the weeds, and really find out what's going on.
It's helpful to get a functional doctor or a naturopath, by the way, if you're going to do this.
Okay. So for somebody who, say, isn't going to do that, but they want to take care of their gut health, maybe it's finances, maybe they can't find a good doctor, and right away they just want to get in there and start doing good things when it comes to the microbiome. Sure. You mentioned probiotics. Talk about how somebody navigates that world, because there's so many different ones out there. Some need to be refrigerated, some don't. Soil-based, spore-based, we could go on and on.
Yeah.
How does somebody begin to determine the right probiotic for them?
Well, I've had kind of like mixed experiences with spore-based probiotics with clients, so I'm not as wild about them as some other doctors are. But, I really like Visibiome in general for people who've just taken antibiotics. I really like Pendulum if somebody has metabolic dysfunction. It's an Akkermansia. And then there's a probiotic for there's really a probiotic for every problem these days. I love the company Biooptimizers. They do a lot of really good research on probiotics. They have one called Cognibiotic. It's a probiotic for brain health. And then there's another company, Seeking Health, makes a histamine X probiotic, and it's great for people who have too much histamine formation in their body. So somebody who is reactive to a lot of, if you eat like cured meats or leftovers, or and you don't react well to that, and your body gets a little bit stuffy, or you have just naturally more eczema and atopy and asthma, like sometimes that's just too much histamine production. And so just lowering that histamine can help with histamine X. So you got to be really careful though. Some people who just kind of fly blind with probiotics, they may end up causing more problems. So if you take a probiotic and you feel worse, it's a pretty good sign that it's not the right probiotic for you.
Earlier, you talked about taking antibiotics and then incorporating probiotics to counteract that. This comes back to what you talked about, what we've been talking about, the mitochondria. And I've heard you talk about how mitochondria, there's this theory where they're actually bacteria that have been engulfed by human cells.
Yeah.
So what comes to mind when I start thinking about that whole concept is the fact that if we're taking antibiotics, they're going to have a negative impact on the mitochondria within the body. So is there any research in that?
Yeah. I mean, there's definitely a lot of evidence that antibiotics can actually cause mitochondrial dysfunction pretty directly, because there's a lot of similar machinery in a bacteria and a mitochondria. So it's not surprising that these things can cause, some issues. So yeah, there's a lot of evidence on this. So you do want to try to avoid antibiotics as much as you can, but I understand sometimes you have to take them.
Let's talk about taking a food-based approach. We went into probiotics and some different options for people, but for somebody who wants to start including more fiber in the diet, fermented foods, how do you feel about that, and how much can get accomplished just taking the food route?
Yeah. So remember that when it comes to so if you're a high histamine producer and you eat a lot of sauerkraut and fermented foods, you might end up feeling worse. So you got to listen to your body. So not everybody's going to need tons and tons of ferments, but if you do really do well with fermentation, it can make a major difference in how you feel. So I would say definitely try to develop a relationship to your body where you can hear what it's telling you. Because if you don't listen, you're not going to be able to hear it. So if you take a bunch of, I love coconut cult personally, because it's a live yogurt. It's not a dead yogurt. Most yogurt's dead. So most yogurt has no live active cultures. And they're just they just throw a bunch of dead cultures in and they call it yogurt. But I'm a big, big believer in live active cultures. And so, when I eat coconut cult, I get better digestion. I have better stools. I have better mood, better focus. That's a good sign. If you are if you take, fermented foods and you feel worse and you get more bloated, you get more issues, you might actually have some small intestinal bacterial overgrowth. And you might be actually pouring more bacteria into a system that has too much growing in the first place. So that's kind of a key concept, is recognizing where you're at with your personal digestion and your personal, health journey.
Which would come back to how we opened up, talking about testing, getting that baseline.
Yeah. I mean, look, I'm still going to be, I've always been a proponent of testing but you do got to find a good doctor who can interpret the tests, and some of these are kind of complicated to interpret.
So we went into antibiotics. Let's talk about other things in the environment that are having a negative impact on the microbiome.
I mean, the big one, again, is always going to be the wrong foods, but also glyphosate isn't everything. So one of the big reasons why I don't consume a lot of grain is because it's glyphosate content. And I have a very sensitive tummy. And if I eat a lot of grain, my gut just gets ripped to shreds. So if you have autoimmunity, if you have Hashimoto's, if you have any autoimmune condition, you should very much consider a paleo diet or a Walls protocol diet, and just see how you feel. Because I'm not really I personally don't think everybody needs to be as restrictive as I am, but I have celiac and I get really reactive to the wrong foods. And so I do eat dairy now, and I do eat occasionally. I'll have some grain, but my body really kind of blows up when I eat a lot of rice or a lot of grain. My body just gets swollen. I can feel it. So it's not great for me, but you may work awesome for you. So if you do really well with pulses, go for it. If you don't, that's okay. And so it's going to take some trial, but some people really do a lot better off of grains and beans because their microbiomes have been compromised. That being said, there's a big movement towards carnivorism, and I'm not a big believer that carnivore diets are healthy long term. Most of the research that I've read has suggested that omnivore diets are the best for longevity and health and happiness. And so, I don't know. I'm an omnivore by nature. I do eat meat. I'm not as worried about red meat as I was when I was younger, but I eat a fair amount of red meat, but I also get it directly from a farm where I know the sourcing, I know what they're eating. And I also bleed every month. And so I run a little bit lower iron as it is. Now, if you have high iron, then you don't want to pour a bunch of red meat into your body because that's going to cause iron overload. So it's key to use some of these biomarkers like ferritin to help triangulate what you should be consuming, what you shouldn't be consuming. Somebody with high ferritin levels needs to give blood and eat less red meat. So going back to your answer or your question of what compromises the microbiome, other things that compromise the microbiome are things like alcohol. So alcohol is a potent cause of leaky gut and liver dysfunction. So I wouldn't recommend that. And then, smoking, terrible for gut health. It's really, really bad. Not exercising, surprisingly, can diminish diversity of the gut. And not eating a diverse diet can also inhibit diversity of the microbiome. So we want to maintain that diversity as much as we can by eating local produce if we can get it. What else talks over gut health? Antibiotics, NSAIDs are a big, big issue. People taking too many pain relievers, thinking that's going to fix their pain. It's actually going to probably contribute to worsening pain. So there's like a vicious cycle of like people get in pain, they take a pain reliever, and the pain reliever causes gut dysfunction, which causes more inflammation, which causes more pain. And stress, psychological stress, big cause of gut dysfunction is just the vagus nerve runs through the body and it affects the function of your digestion. So you can directly affect your digestion by just being stressed out.
You've touched on fasting. How does that impact the microbiome?
Oh, fasting is fantastic for the microbiome. One of the best things you can do. In fact, I had a friend whose wife has Crohn's disease and she went into remission by fasting. That was the main thing that she did. And it was, I think she was doing like 16 to 20 hours of fasting occasionally. It really affected my gut health in a positive way. But you got to keep in mind that if you're really, really, really stressed out, fasting is a stressor. So it's one of those mitohormetic stressors. It's good for you if you're not stressed and you can handle it. It's bad for you if you're highly, highly stressed. So I will probably resume a little bit more fasting when my stress levels reduce a little bit this year. But where they're at today is that they're just a little too high. And so I do a little bit less fasting right now while my stress levels are a bit higher.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
So if you have issues with anxiety, depression, focus, you probably have some energy issues that you're not even looking at. I feel that human connection is like one of the most nourishing things for optimal metabolic health. It really creates the conditions where you